Welcome to the final section of our AHIMA CHDA exam preparation course, where we are bringing everything together through data visualization and reporting. In this lesson, you will learn exactly how to translate complex statistical findings into clear, beautiful charts that anyone can easily understand. This skill is absolutely crucial, because the most brilliant mathematical analysis in the world is completely useless if hospital leadership cannot understand what your numbers mean. Get ready to discover the artistic and communicative side of data analytics, where you turn raw spreadsheet data into compelling visual stories. Let us begin this final step and master the art of presenting healthcare information. And don't forget to utilize our practice tests or the offline app to help cement these concepts as we dive in. Data visualization is the process of representing complex data in a graphical format, making abstract numbers instantly visible to the human eye. The human brain processes visual images significantly faster than it reads rows and columns of text, which is why charts are so effective. When you hand a hospital administrator a massive spreadsheet, they will likely feel overwhelmed and miss the most important trends completely. By converting that exact same spreadsheet into a clean visual graphic, you allow him to instantly grasp the true clinical reality of the situation before you ever draw a single chart. The very first thing you must consider is your specific target audience. A financial report designed for the hospital board of directors will look completely different from a clinical dashboard designed for emergency room nurses. The board of directors needs high-level summaries and broad financial trends, while the nurses need immediate, granular details about current patient wait times. The exam will definitely test your ability to match the correct level of visual detail to the specific needs of your healthcare audience. The most common tool you will use to communicate with these different audiences is a digital dashboard. A dashboard is a single, centralized computer screen that displays a collection of the most critical key performance indicators at exactly the same time. Think of it just like the dashboard in your car, giving you instant updates on your speed, fuel level, and engine temperature all in one place. A well-designed hospital dashboard allows executives to check the overall health of their entire organization within 5 seconds of opening their computer. To build these dashboards, you must know exactly which specific type of chart to use for different types of data. When you want to compare distinct categorical groups, such as the number of patients admitted to different hospital wings, you should always use a bar chart. Bar charts use rectangular bars of varying heights, making it incredibly easy for the eye to quickly identify which category is the highest or the lowest. You should generally organize these bars from highest to lowest so the viewer can instantly see the most important category on the far left. When your goal is to show how a specific metric changes over a continuous period of time, the absolute best choice is a line graph. Line graphs connect individual data points with a solid line, perfectly illustrating trends, spikes, and drops across days, months, or years. If you need to show the hospital's infection rate over the past 12 months, a line graph will clearly reveal if the situation is improving or getting worse. You can even place multiple lines on the same graph to directly compare this year's performance against last year's historical data. If you want to show how a single whole entity is divided into different proportional parts, you will likely encounter the pie chart. A pie chart is a circular graphic divided into slices. representing percentages that must always add up to exactly 100%. While pie charts are very popular for showing simple things like patient demographics, analysts generally try to avoid them if there are more than 4 or 5 categories. When a pie chart has too many tiny slices, it becomes visually cluttered and nearly impossible for the human eye to accurately compare the different sizes. To visually demonstrate the relationship between two completely different numerical variables, you must use a scatter plot. A scatter plot places individual dots on a grid, which is the perfect visual companion to the correlation and regression analysis we discussed in the previous section. By looking at how closely the dots cluster together in a line, you can instantly see if a strong relationship exists between patient age and total medical costs. Scatter plots are incredibly powerful for identifying strange outliers, which are individual dots that sit far away from the normal group pattern. Another highly effective visual tool in healthcare is the heat map, which uses different shades of color to represent the density or intensity of data. For example, you might create a calendar heat map where days with extremely high emergency room visits are colored dark red, while slower days are colored light blue. Heat maps are particularly useful for geographical analysis, allowing you to color a map of your city to show exactly which neighborhoods have the highest rates of diabetes. This instant color recognition allows public health officials to target their medical resources exactly where they are needed most. Creating a chart is only half the battle, as the true goal is to achieve effective data storytelling. Data storytelling is the practice of combining your visual charts with a clear, logical narrative that guides the viewer through your exact analytical process. Instead of just handing over a graph, you explain the background context, point out the specific visual trend, and then offer a solid clinical recommendation based on that trend. A good data story naturally leads the audience to a moment of deep understanding, making them feel like they discovered the answer alongside you. If you want to practice building and interpreting these data stories under exam-like conditions, spending some time with our realistic practice tests or reviewing on the offline app is an excellent way to sharpen your skills. When designing your visuals, you must carefully consider color accessibility, ensuring that your charts are easily readable by everyone. A significant portion of the population has color blindness, meaning they cannot clearly distinguish between the colors red and green. If you create a chart where green means safe and red means danger, a color-blind administrator might completely misunderstand your critical warning. Analysts solve this by using color-blind friendly palettes, such as combining blue and orange, and by adding clear text labels directly onto the charts. One of the most important rules in data visualization is to completely eliminate what we call chart junk. Chart junk refers to any unnecessary visual clutter that does not actively help communicate the data, such as heavy grid lines, distracting background pictures, or complex three-dimensional effects. Adding a 3D effect to a simple bar chart actually distorts the top of the bar, making it much harder for the viewer to read the exact number accurately. The exam emphasizes that the best healthcare visualizations are clean, minimalist, and laser-focused on the actual data points, while live dashboards are incredibly popular. Analysts must also know how to generate formal, static reports. A static report is a fixed document, like a printed PDF, that captures a snapshot of the data at one specific moment in time. Formal reports are legally required for sending annual quality metrics to government agencies like Medicare, where the numbers cannot constantly shift like they do on a live dashboard. Understanding the distinct differences and proper use cases for live dashboards versus static reports is a fundamental reporting competency. When presenting any visual report, you must always establish trust by clearly displaying the data provenance. Data provenance means actively citing exactly where the data came from, the exact date it was extracted, and what specific filters were applied to the numbers. If an executive sees a surprising chart that shows surgical costs dropping, their first question will always be where you got those numbers. By including a small note at the bottom of the chart explaining your exact data sources, you instantly prove your credibility and defend your visual analysis. As you build reports, you must constantly remain vigilant about patient privacy, specifically watching out for the danger of small cell sizes. In data visualization, a small cell size occurs when your chart filters the data down to a group so tiny that individual patients could accidentally be identified. If your public report shows exactly one patient who had a highly specific, rare surgery in a tiny zip code, you have accidentally violated HIPAA privacy rules. Analysts must always suppress or combine these tiny data points before publishing any visual report to the general public. Every single chart you include in a report or dashboard must pass the ultimate test, which is providing actionable insights. An actionable insight means that the viewer can look at the visualization and immediately know what specific clinical or business decision they need to make next. If you create a beautiful, highly complex chart that makes people say wow but does not change their behavior, the chart is essentially useless. The CHDA exam expects you to design purposeful reports that directly drive positive changes in hospital operations and patient care. In modern reporting software, dashboards often include interactive elements like drill-down capabilities. A drill-down feature allows a manager to click on a high-level visual summary, like a red bar showing high infection rates, and instantly open a new screen with more detail. They can keep clicking deeper and deeper, moving from the hospital-wide view down to a specific ward, and finally down to the specific list of affected patients. This interactivity empowers department leaders to independently investigate the root causes of their own data without constantly asking the analyst for new reports. Finally, you must understand secure dissemination strategies, which are the safe methods used to distribute your final reports across the healthcare network. You cannot simply email highly sensitive dashboards containing patient data over standard, unencrypted internet connections. Reports must be hosted on secure internal servers, requiring strict password authentication and role-based access to ensure that only authorized personnel can view the metrics. Managing who gets to see which specific visual dashboard is a critical final step in the data governance lifecycle. By mastering data visualization, you have completed the entire data lifecycle required for the CHDA certification. You now understand how data originates in the medical record, how it is safely extracted, governed for absolute quality, mathematically analyzed, and finally transformed into a compelling visual story. This complete skill set makes you a highly valuable asset to any healthcare organization. capable of turning raw digital chaos into clear, life-saving knowledge. You are now fully equipped with the comprehensive understanding needed to succeed as a certified healthcare data analyst. Congratulations on completing this final section and finishing the entire exam preparation course. To firmly lock in these visualization concepts and guarantee your ultimate success, I strongly encourage you to complete the attached practice tests right now, or log into our offline app to study on the go. Consistently answering these realistic practice questions is the absolute best way to improve your memory retention and ensure your complete exam readiness. This final, highly important practice test and our offline app are included directly with this lesson to finish your training perfectly. Thank you for your incredible dedication to active learning, and I wish you the absolute best of luck on your certification exam.